Hey everyone, this is Dr. Kyle with ICE, and I just wanted to give you a quick demonstration of what a spinal adjustment looks like at our clinic and just give a little background of the reason that chiropractors use this as our hallmark therapy. So just picture in the spine, we have 24 bones and they're broken down into different segments. We have our cervical spine, which is our neck essentially. We have our thoracic spine, and normally there's ribs branching off of that. That's more or less the mid back and starting to get to the upper lower back. And then we have what's called our lumbar spine, and that's essentially our lower back. And then we have this guy down here. This is our sacrum, and then our occiput that are essentially the top and bottom bones of our spine. Now, something to appreciate, and this is what chiropractors specialize in, is the nuances of the shapes of these bones. They're all a little bit different. The lumbar spine is built differently, thoracic and cervical. So understanding how they move relative to each other is really important. And also studying the specific anatomy is really important for your health as well. Because as you can see with this video, these little guys branching off the side are nerves, and then what runs up our spine is our spinal cord. So our spine needs to be functioning properly for our brain to have clear communication throughout our entire body. And again, this is the reason that chiropractors consider adjustments to be so important in regards to health. Now, as I'm going to show you here with my model Michaela, what chiropractors look for is what we call segmental motion of the spine. So we're looking at the specific vertebra and how they're moving or aligned relative to the ones next to it. Now, it's really easy to see on this skeletal model. It's all kind of contorted and mishmash in different directions. But if we were to palpate, so use my hands to kind of feel the different landmarks on the spine, you can easily see right here, this guy is kind of rotated relative to the ones around it. And what that means, the way this landmark works, is it tells you that the bone itself is rotated relative to the others. So my job as the chiropractor is to restore motion and alignment to that segment to make it so not only does this move better in a more cohesive manner, but it also affects the adjacent neurologic structures in that area of the spine that will branch out and control many different body parts around there. So just as a little bit of a demonstration to show you guys, what we will typically do is assess the spine through palpation. So with Michaela here, I'm feeling for which bones feel stuck. And everything is moving pretty smoothly up until I get to that one right there. So my job is to find where it's restricted and try and balance out the motion through an adjustment. And what that's going to look like, Michaela, let me have you take a nice deep breath and then let it out, is just a nice, gentle, quick push where we move the bone and help to restore the motion. So after I've moved it and adjusted it, I'll go back, double check my work, and see that things are moving a lot more smoothly. So that's kind of the idea of a spinal adjustment. And our jobs as chiropractors is to make sure that your spine is moving healthily as an entire unit, but also more specifically on those bony relationships between each other. So when you come into our clinic, that's a little bit of what to expect. Hopefully that better explains it for you watching.